what is it? Which one is it? Is the government invoking its ability to get the manufacture of these things, or are they not? Because the messages are entirely clear from everyone in the medical and public health community with whom I've spoken to in the last few days. There are about to be critical shortages.
Yeah, and we're in full preparation mode for what is to come over the next several weeks. And in our hospital and hospitals across our system in West Michigan, we're conserving masks. We're using the same mask for an entire shift and storing it in a paper bag and sterilizing our hands as we put the mask on and take the mask off as we go into every room. We understand that with the influx of patients that we are anticipating, these supplies will run out at some point. So I don't know what they're doing behind the scenes, but certainly the mixed messages from the president, or if he is declaring that no one has told him that it's a problem or doctors aren't saying that to him. If he's watching right now, there's a doctor here, and I'm representing many doctors across this country. We need their help. We need leadership in this respect.
Dr. Davidson, let's just play this out for a second. Let's say I'm not believing any of this hype, right? Somehow I'm consuming the information the president's putting out there that anybody who needs a test can get tested. There's no shortages. We don't need to invoke these kinds of things. And all of a sudden, I'm a man of a certain age. I get a heart attack, or something else happens, or my appendix needs treatment. And I call 911 and I go to a hospital and I find out that there are beds that are problematic, or you've been using the same mask all day, or the Red Cross says they might be 2 weeks away from running out of blood. This is not just about coronavirus. This is about our entire medical system.
Absolutely. I mean, our committee of doctors, the Committee to Protect Medicare, is advocating for affordable health care, before this started, after we eventually see our way through this. But this is what I tell people who try to say, well, I won't be affected, or I have such a low likelihood of being affected myself. We see young, healthy people on ventilators, already with this crisis. But if our hospitals are overwhelmed with patients with coronavirus, what happens? That's what I'm concerned about. I've been serving in my community for over 20 years, or for nearly 20 years. And, I've kind of taken a pledge to serve those folks. And, we have to make tough decisions from time to time. I don't want those decisions to be tough because my government has let me down and not gotten us the equipment we needed. If he thinks that anyone who wants a test can get a test, I can tell you I've worked the last 3 nights. And just a few nights ago on one particular shift, I saw a handful of patients. Each one of them should have had a test if they were available. But we are rationing tests because they just aren't there. We're saving them for the sickest patients.
So Dr. Davidson,
we're sending people home and telling them,
I don't mean to interrupt you, but let's just be clear about this. In fact, I'm going to ask my control room to just play a shortened version of an answer, a conversation between our PBS colleague, Yamiche Alcindor, and the president about the availability to testing. Let's listen to this.
There are Americans, though, who say that they have symptoms and they can't get tests.
Well, okay.
What do you say to the Americans who are scared that they have symptoms?
I'm not hearing it. Dr. Davidson, is that a possibility? I mean, I'm not in the business of accusing the president of lying if I don't know otherwise. I don't imagine how any American has heard that there aren't shortages of tests for people who may need them.
Right. If he's not hearing it, he's not listening, because we've been crying out as a chorus of doctors and nurses and folks in healthcare across this country. I will tell you, there is a shortage. We are rationing. In the United States of America, we are rationing these tests. Our first case in this country was the same day as the first case in South Korea, and they were testing 10,000 a day from a week after that. And we're still struggling in my state, and I know in states across this country, but in my hospital, again, a handful of people, 5 people I saw on a night shift, and not one of them could get a test because, frankly, we just are told we don't have the ability to do that. This is coming down from the state. They have limited supplies. I understand why the state is doing this. But for the president to suggest that, again, I guess I wouldn't be in the business of calling him a liar, but he's obviously not listening to the people on the front lines.
Dr. Davidson, let's talk about remedies for this. We've heard all sorts of things. There are people who are asking for the National Guard, for the Army Corps of Engineers, for emergency hospitals to be built, for the Defense Act to be invoked so that manufacturing companies can be caused to make some of these things. Others are calling for a shutdown, a near total shutdown. Now, there are very many people who are already worried about the economic situation, saying what would happen if you shut the country down for a month. Tell me what you think should be done.
Yeah, our organization today came out very strongly, and we are supporting a national, essentially a national shutdown. And I think this has to be for a defined period of time, but this has to be in conjunction with massive testing. We all hear about the surge, and what we know, we can handle the number of patients we may get eventually over a period of maybe 4 months, 6 months. We can't handle that same number of patients in a span of a month or 2 months. And so if we can dedicate ourselves to truly having, essentially a shutdown where people are having extreme measures of social distancing, combined with a massive number of tests being done on the well and the unwell, so we can truly identify where these hotspots are, we can then start resuming business in certain parts of the country and certain communities and do it safely while we're monitoring. This lack of testing has put us behind, but the lack of decisive leadership in this respect is putting us behind the 8 ball even further. This is all we want right now, is a national approach to this national problem. The virus just doesn't care if it goes across the Illinois border from Indiana into Illinois. If Illinois is shutting down, but Indiana is not, those people in Illinois aren't protected. My governor in Michigan is protecting us, but, we need this across all 50 states.